is this shit? Wait a minute here.
Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. And we begin our briefing with opening remarks from Mayor Kenny. Mayor, you have the floor.
Good afternoon, Mike, and good afternoon, everyone. Quick personal update. I remain quarantined, and I'm waiting for the results of what I hope to be my final COVID-19 test, but I remain symptom-free, and my previous test was negative. I feel fine, and I hope to be back in the office as soon as tomorrow. Reminder that October is Domestic Violence Awareness Month, and I want to focus on this important issue for a few minutes. More than ever, in the midst of this pandemic, we want survivors to know that services and support are here for you. When the stay-at-home order began in Philadelphia, we worried about those for whom home is not a safe place to be. Survivors of domestic violence have always relied on their communities to help them stay safe. They reach out for help to their friends, family, coworkers, or to one of the amazing agencies in the city of Philadelphia working to end the cycle of domestic violence. But right now, survivors are at high risk of being isolated in their homes, unable to access their supportive community. Through the work of our Office of Domestic Violence Strategies, we are being creative about reaching survivors as the pandemic threat continues. We continue to advance practices within the Health and Human Services to provide the city's response to survivors when they come to us for assistance. We also want all Philadelphia residents to be part of the larger community that is dedicated to helping those affected by domestic violence. You all can help. Check on your friends and neighbors and ask them if they're okay. If you know someone who needs to change their behavior, challenge them to be a better partner. Let's provide good examples of healthy relationships for the children and youth in our communities. Parents, talk to your teens about what they want in a relationship and how they would know if someone is a good partner. If you don't know anyone who needs help, please let them know about the Philadelphia Domestic Violence Hotline. It's 866-723-3014. That's 866-723-3014. Remember, safety in our homes is safety in our community. Finally, one important note. I'm pleased to announce that the deadline for phase 2 of the COVID-19 Emergency Rental Assistance Program has been extended. The new deadline is now November 4th, 2020. Residents who applied for phase 1 can still apply for phase 2. So if you are facing difficulties in paying your rent, please reach out and take advantage of this help. To apply for this assistance, visit PHL Rent Assist.org. That's PHL Rent Assist.org. And now for Dr. Farley.
Thank you very much, Mayor. We are unfortunately seeing a substantial increase in the daily case counts of the coronavirus infection here in Philadelphia, which is a reason for concern. I'm going to talk about that. I'll also talk about new CDC guidance on airborne spread of the virus, new event limits that the governor has announced today, some thoughts about Halloween, and I'll finish with some thoughts about the president's infection. First, though, the numbers. Since this time yesterday, we have identified 250 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 37,812 since the beginning of the epidemic. In addition to that, we had 28 new probable cases that are diagnosed by rapid test only. Now, 250 is a large number, and some of that 250 is because we are getting reports on backlogged cases. We reported 55 cases yesterday. We are having a problem with the electronic transmission of laboratory data to us. Some of our case reports are from more than 7 days ago. But also this large number is part of a pattern of increasing cases. For the past week that ended last Saturday, October 4th, by the date in which the sample was collected, we we averaged 110 cases per day. And of those people tested, 3.9% were positive. That's substantially higher than the week before, where we were averaged 86 cases per day and 2.9% people were positive. Now, if you have attuned to these previous press conferences, you may notice that 86 and the 2.9% are higher than I reported a week ago. And that is because of those delayed results we're receiving now from the week before. Now, the reasons for this increase in case activity is not entirely clear. We do know that we are seeing continued clusters and spread on college campuses in the city. We're seeing spread at Temple, at Jefferson University, there, in particular the undergraduate campus, St. Joseph's University, and some cases at Drexel and at the University of Pennsylvania. In those universities, it appears to be that this is spreading at social gatherings, not being spread in the classrooms. But we're also seeing increases in other age groups, not the college age group, and in other areas of the city, particularly in the far northeast. And it's less clear why we're seeing increased transmission there. Since this time yesterday, we've identified one new death from the coronavirus, bringing us to a total of 1,817 from the beginning of the epidemic. We're averaging now about 15 deaths per week. Then in our nursing homes and other congregate care facilities, we are seeing more viral activity in the past couple of weeks. We were getting 1 to 2 cases per day for all those institutions across the city in mid-September. Now we're getting maybe 3 to 5 cases per day. Now that's not a big increase. Those are not large numbers, but those numbers are still very concerning because people in these situations are very medically vulnerable. In our schools and daycares, there is somewhat better news there. We are continuing to have isolated cases in students and in staff, but we have not yet seen any clusters in the K-12 schools where it is clear that the spread has happened within the school. It appears that most of the cases, and perhaps all the cases, the spread, or the cases are occurring because people are bringing it to the school, but it's not necessarily spreading in the classroom. That's what's happening here in Philadelphia, in Pennsylvania, and in New Jersey, and in New York State, and in the United States as a whole. Case rates are now rising. They're seeing college outbreaks in many parts of the country. Those college outbreaks continue, and they are an important reason for this increase, but they're definitely not the only reason. So the overall message now, in view of the increasing cases we're seeing here in Philadelphia and what's happening around us, is that risk is increasing right now. So people should be especially concerned and especially focused on wearing masks to protect yourselves, protect the people around you. I'll talk more about that in a minute. Now, yesterday, the Centers for Disease Control posted new guidance on how the coronavirus, COVID-19, can be spread. This guidance is very carefully written, and I believe it is reflective of the scientific studies as I understand them. And this guidance acknowledges that most of the time, the coronavirus spreads by droplets amongst people who are within 6 feet of each other. However, it can be spread airborne beyond 6 feet, especially in certain situations. That would be especially in enclosed spaces where there's inadequate ventilation, and when people are putting out respiratory droplets or breathing in many respiratory droplets, such as when they're shouting or singing or exercising. So the lessons here is that masks are particularly crucial, and that indoors, ventilation is important. And outdoors, where ventilation is naturally much, much better than it ever is indoors, it's going to be far safer than indoors. Now, just this morning, a couple of hours ago, the governor announced new rules for limits on events across the state of Pennsylvania. Previously, the limit was 25 people allowed for an event or gathering indoors and no more than 250 people outdoors. The new rules that the governor announced today changed the limits, and they're based not on a single number, but instead based on the size of the venue. Indoors, on a very large venue, it could be that hundreds of people could get together for an event, or in very large venues, up to 3,750 people. Outdoors, at very large venues, it could be up to 7,500 people. Now, we do have concerns about this in Philadelphia because we do have unique risks in the city. We have many huge venues, stadiums, concert halls, arenas, a convention center, that draw people from across the region and, in fact, across the entire United States. We also have outdoor spaces that people use for gatherings and events, like, for example, Penn's Landing. We're also the largest, most densely populated city in Pennsylvania. We're the city that's been hardest hit with COVID. And as you've seen now, our case rates are rising. In the past, if we felt that the governor's policies were not safe enough for the city of Philadelphia, we have been more restrictive than the Commonwealth. And we'll continue to be more restrictive if necessary, if we believe it is necessary to protect the people in Philadelphia. So the governor's guidance was just announced a couple of hours ago. We will review the guidance and we will announce what the new policies are for Philadelphia at this press conference next Tuesday. A few words on Halloween. We received many questions about Halloween. We're not attempting to cancel this event. I'm not really sure that it would be possible to cancel such an organic event as that. But we do think that children and families should take actions to stay safe. And we are posting guidance today about how they can do that. The key rules of this guidance are that keep the Halloween activities outdoors where there's good ventilation. It's much less likely to spread. The virus is much less likely to spread, that is. That's number one. Number two, wear masks. When I say masks in this context, I mean masks that prevent COVID, not the scary Halloween kind. And third, people should keep 6 feet away from those that are not in that household, which is to say, don't gather. You can go back and forth from house to house, but don't gather. And finally, don't participate in Halloween activities, either as a trick-or-treater or someone giving out candy, if you are sick with symptoms, or if you've been exposed to someone with COVID recently. And finally, some thoughts about the president. President Trump chose to not wear masks and discourage others from wearing masks, despite medical advice otherwise. And he got infected. That clearly was a mistake. I think we can draw 3 lessons from this. First, that the president should have listened, and we all should listen to the medical advice, which is to wear a mask and ask others around you to wear a mask as well. If you don't do that, you're likely to get infected. It's very simple. Second, testing is not a substitute for masks. I hear and I frequently read suggestions that we need to do more testing, or even the suggestions that if we only tested people more, we don't need masks. And in fact, yes, we do need to do more testing, but testing by itself does not prevent the spread of COVID. The president was tested every single day, perhaps even more than once a day. And people in the White House, though, they didn't wear masks, even indoors. And in fact, the testing may have hurt that situation because the president and others thought that they were tested often enough that they didn't need to wear masks. Just remember this. So testing is not a substitute for masks. Remember that. Testing is not a substitute for masks. The third lesson is that you should be afraid of the coronavirus. I strongly disagree with the president on this one. The coronavirus has killed more than 200,000 people across the United States of America and killed more than 1,800 people here in the city of Philadelphia. COVID put the president of the United States into the hospital. Now, his chance of dying is about 5%, which means he'll probably recover, 95% chance he'll recover, and I certainly hope that he does. But I would not recommend that anyone take a 5% chance of dying. That's 1 in 20. I would not recommend that anyone take that chance. All those 3 lessons add up essentially to the same lesson, which is wear a mask. This simple technology can protect us against this virus. Wear it whenever you're around people who are not your household members. Thanks very much. If you want more information, go to our website, www.phila.gov/COVID.
Thank you, Dr. Farley. And now we will move to Armando for the Spanish language translation of the mayor's and Dr. Farley's comments.
Palabras del alcalde Jim Kenney para el 6 de octubre del 2020. Buenas tardes. Como habrán visto, el alcalde sigue en cuarentena. Se encuentra esperando los resultados de lo que se espera sea su examen final del COVID-19. El alcalde sigue sin mostrar síntomas y su prueba anterior también resultó negativa. El alcalde se siente bien y espera estar de vuelta en la oficina, quizás para mañana. Muchos se preguntarán qué significa este fondo morado detrás del alcalde. Es un recordatorio de que octubre es el mes de la concientización sobre la violencia doméstica y que vamos a conversar de este tema tan importante por unos minutos. Más que nunca, en medio de esta pandemia, queremos que los sobrevivientes de la violencia doméstica sepan que tienen disponibles los servicios y el apoyo necesarios. Cuando comenzó la orden de permanecer en casa en la ciudad de Filadelfia, nos preocupó que aquellos quienes están en el hogar, que no es un lugar seguro, se vean expuestos a esta violencia doméstica. Las mujeres y los hombres que la han sobrevivido siempre han confiado en sus comunidades para mantenerse seguros y les piden ayuda a sus amigos, a sus familiares, a sus compañeros de trabajo o incluso a una de las increíbles agencias de la ciudad que trabajan para poner fin al ciclo de violencia doméstica. Pero en este momento, estos sobrevivientes corren un alto riesgo de quedar aislados en sus hogares y no pueden acceder a su comunidad o a sus grupos de apoyo. A través del trabajo de nuestra oficina de estrategias contra la violencia doméstica, estamos siendo creativos para llegar a los sobrevivientes mientras continúa la amenaza de esta pandemia. Nosotros seguimos avanzando en las prácticas dentro de los servicios humanos y de salud para mejorar la respuesta de la ciudad a los sobrevivientes cuando nos contactan en busca de ayuda. También queremos que todos los residentes de Filadelfia sean parte de una comunidad más amplia que se dedique a ayudar a las personas a quienes afecta la violencia doméstica. Todos ustedes pueden ayudar. Por favor, hable con sus amigos y vecinos y pregúnteles si están bien. Si conoce usted a alguien que necesita mejorar su conducta con su pareja, motívelo a ser un mejor compañero. El maltrato y la violencia doméstica nunca son justificables. Brindemos ejemplos de relaciones saludables para nuestros niños y jóvenes. Padres, hablen con sus hijos adolescentes sobre lo que quieren encontrar en una relación y cómo pueden saber si alguien hace una buena pareja. Si conoce a alguien que necesite ayuda, háblele sobre la línea directa de violencia doméstica de la ciudad de Filadelfia. El número es el 1-866-723-3014. 866-723-3014. Y recuerde, la seguridad en nuestros hogares significa seguridad en nuestra comunidad. Finalmente, una nota muy importante. Me complace anunciar que se ha extendido el plazo para la fase 2 del programa de ayuda de emergencia para los inquilinos durante la crisis del COVID-19. La nueva fecha límite es ahora el 4 de noviembre del 2020. Los residentes que solicitaron el programa en la fase 1 aún pueden hacerlo para la fase 2. Por lo tanto, si tiene usted dificultades para pagar el alquiler, comuníquese y aproveche esta ayuda. Para inscribirse, visite phlrentassist.org. Y esta es la actualización en materia de salud para el día 6 de octubre del 2020. El conteo de casos se ha incrementado desde la semana pasada y esta es una razón para preocuparse. Asimismo, los Centros de Control de Enfermedades emitieron una nueva guía sobre la propagación del COVID-19 en el aire. El gobernador de Pensilvania anunció nuevas pautas para las reuniones en espacios interiores. El Halloween o la Noche de Brujas está ya a la vuelta de la esquina. Y como bien saben, el presidente Trump contrajo el coronavirus. Pero comencemos con los números de hoy. En total, reportamos 250 nuevos casos en Filadelfia, con un total de 37.812 casos. Muchos de estos corresponden a datos retrasados, y ayer reportamos 55 nuevos casos. Estamos teniendo problemas con la distribución electrónica de los datos por parte de los laboratorios. Y este incremento muestra que hay un patrón en el incremento de los casos. La semana pasada, finalizada el sábado 3 de octubre, tuvimos 110 casos en promedio diariamente. Esto es un 3,9% de casos positivos. Estos números representan un porcentaje mayor del reportado la semana anterior, en la que el promedio diario de los casos era de 86 con un 2,9% de casos positivos. Esto es más alto que los resultados que se informaron hace una semana debido a resultados retrasados. 74 casos en promedio diariamente y 2,5% de casos positivos. Algunas razones son los contagios en las universidades: Temple, Jefferson, St. Joseph's, Drexel y la Universidad de Pensilvania. La causa probable son las reuniones sociales y no las clases presenciales. Pero ha habido aumentos en otros grupos de edad y de áreas, aunque no está claro por ahora el porqué. Con respecto a las muertes, hoy reportamos un nuevo fallecimiento con un total de 1.817 fallecidos. El promedio para la semana pasada es de 15 muertes semanales. En los entornos congregados y hogares de ancianos hemos visto un ligero incremento de casos en las últimas 2 semanas. A mediados de septiembre teníamos 1 a 2 casos diarios, pero ahora tenemos entre 3 a 5 casos diarios. Estos no son números grandes, pero es preocupante debido a que se está dando en las poblaciones más vulnerables. Y no hemos visto brotes de contagio en las escuelas, que están abiertas desde el jardín de niños hasta el 12º grado. Hemos observado, sin embargo, casos aislados, sin evidencia de propagación entre algunos alumnos y personal académico. Con respecto al estado de la epidemia en Pensilvania, en New Jersey y en el resto de los Estados Unidos, vemos que los casos van aumentando, que hay brotes en las universidades que continúan y esta es la razón principal. Pero esta no es la única razón del incremento. Los Centros de Control de Enfermedades emitieron una nueva guía sobre cómo se propaga el COVID-19. Esto se hizo con cuidado y nosotros pensamos que no fue escrito por razones políticas. La guía reconoce que el COVID-19 se propaga por gotitas dentro de los 6 pies o 2 metros de distancia de la persona. Puede esparcirse en el aire más allá de 6 pies, especialmente en espacios cerrados con ventilación inadecuada, en espacios cerrados donde hay personas que están gritando, cantando o haciendo ejercicio. Y hay lecciones que hemos aprendido. El uso de las máscaras es crucial. En espacios interiores, la ventilación es importante. Es mucho más seguro realizar actividades al aire libre, donde la ventilación es mucho mayor. Hay nuevas reglas para los eventos que anunció el gobernador Wolf esta mañana. Los límites pasaron de 25 personas en espacios cerrados y 250 al aire libre a una proporción de ocupantes según el tamaño del lugar. En lugares muy grandes se permitiría desde cientos de personas en el interior hasta menos de 3.750 personas. Al aire libre, menos de 7.500. Pero nosotros tenemos muchas preocupaciones en Filadelfia porque los riesgos en nuestra ciudad son únicos. Tenemos muchos lugares enormes, estadios, salas de conciertos, arenas, centros de convenciones, que atraen a personas de toda la región y de todos los Estados Unidos. Contamos con espacios al aire libre para reuniones, tales como Penn's Landing, pero hay que tomar en cuenta que Filadelfia es la ciudad más grande y más densamente poblada de Pensilvania, y hemos sido nosotros los más afectados por el COVID. Por eso, hemos sido más restrictivos que el resto de la mancomunidad de Pensilvania, y continuaremos siéndolo si es que es necesario para proteger a las personas. Nosotros revisaremos y anunciaremos los límites para eventos en Filadelfia la próxima semana. Con respecto al Halloween o la Noche de Brujas, hemos recibido muchas preguntas al respecto. No estamos intentando cancelarlo, pero las familias deben de tomar medidas para permanecer seguras. Publicaremos la guía en inglés hoy y en español en el transcurso de esta semana. Algunas reglas claves es que se mantengan las actividades al aire libre, que se usen máscaras o mascarillas para prevenir el COVID, no las mascarillas o las máscaras de Halloween. Manténgase a 6 pies de los que no sean de su grupo familiar, por favor, no se reúna. Y no participe si usted está enfermo o estuvo expuesto ya a alguien con el COVID-19. Ahora quisiera hablar sobre el presidente Trump y su contagio. El presidente decidió no usar mascarillas y desalentó a que otros las usaran. Él se infectó con el virus por este grave error. De esto hemos aprendido 3 valiosas lecciones. Primero, escuche los consejos médicos, use la mascarilla y pídale a quienes lo rodean que hagan lo mismo. Si no lo hace, es probable que se infecte. Así de simple. Segundo, las pruebas no sustituyen a las máscaras. Escucho y leo frecuentes sugerencias que la gente pide que se hagan más pruebas. O comentarios como, si la gente se realiza la prueba, entonces no se necesitarán las máscaras. Es cierto, necesitamos hacer más pruebas, pero las pruebas por sí solas previenen la propagación del virus. El presidente probablemente se realizó las pruebas del COVID-19 más de una vez por día. Pero las personas en la Casa Blanca no usaban mascarillas ni en interiores ni en exteriores. De hecho, las pruebas pudieran haber dolido, ya que él y otros pensaron que si se realizaban este examen, las máscaras no iban a ser necesarias. Pero nuevamente se comprobó, las máscaras no sustituyen a las pruebas y viceversa. Recuérdenlo. La tercera lección que aprendimos es que aún hay que tenerle miedo al coronavirus. Y estoy totalmente en desacuerdo con el presidente. En los Estados Unidos, más de 1.000 personas han muerto por el COVID-19 y en Filadelfia, más de 1.800 personas. El COVID-19 puso al presidente al hospital. Su probabilidad de morir está alrededor del 10%. En un 95% probablemente se va a recuperar. Y ciertamente esperamos que lo haga de forma satisfactoria. Pero yo no le recomendaría a nadie que se expusiera a estar dentro de ese 5% de probabilidad, porque una de 20 personas puede morir a causa del COVID-19. Use estas 3 lecciones sabias que resultan en una sola. Use una mascarilla cuando esté alrededor de personas que no sean de su hogar. Juntos podemos ganarle al COVID-19, así que cuida de ti y de tus seres queridos usando tu mascarilla. Muchas gracias.
All right, thank you, Armando. We're now going to move to the Q&A portion for members of the media. And again, the briefing is on topics related to the COVID-19
last press briefing, Dr. Hyde expressed the need for funding. If it comes down to the school district pushing in-person learning to the spring, can the city assure funding assistance for the district if youth cases continue to rise?
Funding issue has always been a difficult issue. Obviously, the state is still responsible and has been responsible for funding thorough and efficient education for our children. The city has attempted and been successful in replacing about $1 billion in lost state revenue in the last 5 years. We'll continue to try to fund our schools the best we can and the way they deserve to be funded. But the city is facing a $750 million deficit, and I think the school district is looking at $600 or $650 million. At some point in time, we got to decide what our priorities are and whether we're going to develop the revenue and get the revenue to fund education or not. So that remains to be seen as to what city council, the state legislature, the federal government are willing, and the taxpayers willing to do relative to having a thorough and efficient and successful education experience.
Thank you.
Okay, thank you, Johan. And we go now to Laura McChrystal of the Inquirer.
Hi. First, a question for Dr. Farley. You mentioned that there are clusters in college students and also a rise in cases in the Northeast. Are cases in other age groups other than college students spread throughout the city, or are they clustered in the Northeast at this point?
It does appear that we're seeing increases across the city. It's not only in the Northeast, and it does appear to be many age groups. It's not just the college age group.
Would you have any reason to believe at this point that it's linked to, the opening of indoor dining or other reopenings that the city has allowed?
We're looking for that when we're doing our contact tracing to see if there's evidence that there was people, say, multiple diners together who got infected or multiple cases associated with one restaurant. So far, we're not seeing evidence of that. It can be something we can miss, but so far we're not seeing evidence that it's linked to the indoor dining.
Okay, and one last question about the Halloween guidelines. What are guidelines for people who would want to pass out candy to trick-or-treaters? How should that be done?
That's included in the guidance. Basically, they should be keeping their distance from the children, ideally having the children grab the candy themselves. I think you have to look, I forget the details, but the main thing is keeping the distance from the children who come up to the house.
Okay, that's all from me. Thanks.
All right. Thank you, Laura. We're going to go now to Miles Bryan of WHYY.
Hey, can you folks hear me?
Yes, go ahead.
Hey, I wanted to ask a question about outdoor dining. This is for Mayor Kenny. The first question is, do you support Councilman Dom's bill to extend the COVID easement on outdoor dining, making it easier to bring seats out through 2021?
In concept, yes, but there's always the details that are the most painful to deal with. What streets are allowed to be closed, what times do the people who live around there support or don't support the closure of the street. There's everybody has an opinion when it comes to changing the status quo. In concept, I do agree that we need to give our restaurateurs as much help as possible when it comes to expanding their footprint. But as long as that footprint isn't impeding anyone else or people who will complain about it, there's always more than one opinion about these things.
Hey, can you hear me?
Yep.
I'm sorry, I dropped it for just a sec. What's the last thing you said?
I said there's always a difference of opinion about these things when it comes to restaurateurs, customers, people who live in the neighborhood, seniors. I mean, there's drivers, bicycle people. I mean, there's always some different opinion about closure of public space. But in concept, I do support giving them the opportunity to try to make up some of their losses.
Miles, you're still muted. Did you have anything else?
Yes. Sorry about the technical glitches. So just to be clear, do you support would it be accurate to say you support this bill? And then the final question is, New York has made these changes permanent. Would you support that as well?
At this point, I'm not really ready to commit to permanent. Again, I told you I support the bill in concept. The devil's always in the details, and the details sometimes are touchy and tricky to work out. But again, I would like to see restaurateurs have the opportunity to pick up some of their losses and give them some bigger footprint.
Thank you.
All right. Thank you, Miles. Let's go now to Manny Smith of CBS.
All right, I got 3 questions on behalf of my team. First, going to be for Dr. Farley. I know that many, the Wolf's order has been, or outdoor gathering order has been thought about in mostly the sport arena. I know you said next Tuesday is when we're going to get your specific recommendations, but before that, what's your updated advice on people who want to go to outdoor weddings and larger events, specifically around weddings and those type of social activities?
So Manny, you broke up. I didn't get entirely the question, but I understood the question to be, what do I recommend for people doing gatherings in the meantime, particularly around weddings? You say social gatherings are the major way in which the virus is spreading right now amongst people in Philadelphia after households. All right, mainly, first it's being spread within households, and then it's being spread at social gatherings. So I would recommend people be very cautious about social gatherings, especially social gatherings indoors. People, when they're gathering for weddings or other social gatherings, they tend to eat or drink. When they're eating or drinking, they're not wearing masks. A group of people indoors not wearing masks is exactly what we're mainly concerned about. I would recommend if people gather at all, that they do it outside, that they limit their numbers. Our limit in Philadelphia is still less than 150 people outdoors, that they wear masks and they keep 6 feet from each other.
Manny, are you set?
I got you. Second question. Yes, that's good from Dr. Farley. Thank you very much. We had 2 more quick ones for the mayor that are COVID related. Number one is, wanted to see if the mayor could clarify again the testing he's waiting for that would clear him from quarantine, and if he could juxtapose why he's waiting compared to President Trump, who has obviously been on a world tour.
Had become exposed a little over 2 weeks ago. Was advised by the doctor to go to get a swab test, which I did, and it was negative. But because of the contact, had to go into quarantine for 2 weeks, which was yesterday, and had another swab test yesterday, waiting for the results of that. Hopefully I'll be negative and can come back to work. I just think that, look, my opinion of Donald Trump is not a good opinion, so it's not, I don't feel like I'm going to be fair in saying that. I just think the irresponsibility of what he did last night, standing on the Truman balcony, ripping off his mask and sending tweets to people telling them not to let COVID interrupt your life or dominate your life, and it's just like the flu, is simply just, it's pacing the death of people, pacing the death of Americans. And apparently he don't care. And what's important to him is getting reelected. And another 20, 30, 40,000 Americans could die because of what he says, and he don't care. So I just think people should follow the rules, stop being selfish, look out for other people, wear your masks, and understand that you're wearing your mask and you're doing these things to keep other people safe in addition to yourself. Again, I've said this before, harken back to the World War II, when our population was asked, our citizens were asked to do so many things to sacrifice to win the war. I don't see that kind of care and concern about our fellow Americans that I read about and have heard about back in the 1940s.
Manny, are you set?
Yep, we have one more mic there. Governor Murphy yesterday was angry with President Trump for going to an event last week in Bedminster with the possibility that at least some people at the White House knew about some of those positive tests. Question for you is, with campaign activity, either from the Republican or Democratic side, are you prepared to enforce candidates not coming to Philadelphia to campaign if there's some information or future diagnoses of either candidate or their teams during the rest of the campaign season?
I don't see how you can stop someone from coming to to Philadelphia if it's the president of the United States or the vice president or a candidate running for office against them. Would I rather? When Donald Trump comes here, it's chaos. It costs us money. We have to do police overtime. We have public property issues. We have protest issues, and it's a pain. But I don't see of any way we can stop it. We just would hope that whoever comes here to campaign would do so safely, responsibly, and care about Philadelphians' health.
Thank you, Manny. We're going to go now to Kennedy Rose, but I will say that after Kennedy, we will move to a second round and can open the floor to questions on other topics. But for right now, Kennedy Rose of the Philadelphia Business Journal.
Hi, I have two quick questions for Dr. Farley. I was wondering, Doctor, are you comfortable with the city hosting any sort of large outdoor events, such as, say, hosting games at Lincoln Financial Field or reinstating tailgating?
And right now, we are not. Right now, our limits for outdoor gatherings are 150 people. As I said earlier, the governor changed his rules, and we will look at those and we'll announce what our policy is for those next Tuesday.
Okay. And just to follow up, I was wondering, what were your specific concerns with, say, large outdoor events if people are socially distanced? Just what are the risks there?
The risks are that people will still, if they get in a crowd, they'll still get closer than 6 feet together, that they'll take their masks off in the excitement of the moment. And if you have hundreds or thousands of people, there's a huge number of people that could be exposed at a single event. Those can really greatly influence the course of an epidemic if they do have that level of exposure.
Okay, thank you very much.
Thank you, Kennedy. And with that, we will move to a second round and start off with Jeff Cole of Fox 29.
Yep. Hello. Questions for the mayor about violence. Mayor, the Commissioner Outlaw had a press conference today to talk about the homicide numbers in the city topping or at last year's number. Mayor, do you think the police department is doing an adequate job to combat gun violence in the city?
I think the police department's doing everything that they can do. I think our officers are on the street bravely every day facing well-armed criminals. They are taking hundreds of guns off the street in a given month. They are patrolling our streets, trying to get between combatants who are dead set against killing each other. If you couple in the pandemic, the economic crisis, and the rise in gun violence, I think it's just a toxic stew that we're been going through. And as we get out of the COVID issue, hopefully soon, and get back on track financially, we'll have the opportunities to interact with people in a more close way, and the opportunity to refer people to job training and to jobs when the economy starts to rebound. So I think the combination of those three things is what's caused this this unbelievable rise in what we're dealing with. I think once we start moving out of this mess, we can start getting those numbers under control.
And Jeff, also with us today is Vanessa Garrett Harley, the Deputy Managing Director who oversees the Office of Criminal Justice and the Office of Violence Prevention. Vanessa, do you want to add anything?
No, I would just say I do believe the police are doing everything that they can. I believe we all are trying to do everything that we can. Gun violence is very, very complicated. And it is not just Philadelphia, not that it gives us any solace, but in all of the big cities across the country, we're all facing this. The pandemic certainly has stretched resources very thin, but the other thing that the pandemic has done is making violence prevention programming and fighting gun violence is more difficult because of the pandemic, and it's very difficult to do violence prevention, tight work, social distancing. But I do think that we're all trying to get a handle on this and working as closely together as we can, as well as trying to work with the community, because that is also key, is folks in the community coming together to work with us. And we do have some community partners who have really been trying to help as well.
And don't lose sight of the fact that it is easier to get a gun in the city of Philadelphia and the United States of America than it is to get a driver's license. And as long as that situation exists, we are the most armed country in the world and one of the most violent countries in the world. So having all those arms and all that ability to get weapons and stockpile guns in your house and get guns on the street, that does not make us safer. It makes us less safe. And that's a major factor in what we're dealing with.
Quickly, the commissioner spoke of a 10% drop in homicides over the last month. And she says that's a positive sign. Do you see a drop as small as 10%? Is that a positive in your view, or indicative of simple short trend?
Oh, for every one less homicide, it's a plus. Of course, we want to save as many lives as possible. I think 10% is substantial in a month. And if we can keep that trend going, we'll start to drive those numbers down.
Your people, an alert went out here this afternoon, Mayor, for an event tomorrow. Is the city going to sue the state once again over what you believe are lax and dangerous?
We're going to have to wait till tomorrow, and that's why we have a press conference.
Thank you.
All right, thank you, Jeff. Let's go now to Annie McCormick of 6 ABC.
Hi, this question is for Dr. Farley. Can you hear me?
Yes, go ahead. I'm sorry. Go ahead, Annie.
Okay, that's okay. This question is for Dr. Farley. In regards to the large gatherings, this is a two-part question, so it's technically two questions. But what will you consider when making your decision? Just kind of what's the list going through your head of things that you have to consider? And secondly, what types of gatherings are you talking about? Is the Christmas Village and parades that were originally canceled, is there a possibility that they could actually come back?
Well, yes. As far as the first question, we'll look at the size, the number of people involved, the density and the location, and whether protocols can be put in place and enforced in which people are wearing masks and keeping distance from each other. And the difference between indoors and outdoors is very important here, as I mentioned earlier with the airborne. As far as what events that might have an impact on when we come up with a decision, I really can't say at this point.
Yeah, and let me just add something else. Philadelphia obviously is the largest city in the Commonwealth of Pennsylvania. We have different issues and different problems as compared to some place in a small town in the center of the state or along the northern tier. So when the governor and folks are getting pressure from legislators and others to do certain things and to kind of open up more, it's coming from areas that aren't experiencing the type of infection that we're experiencing. Even Pittsburgh's, I think, half our size. So you can't apply one standard to Tioga County that you would apply to Philadelphia County. And I think that's the difficulty in articulating our issues to the public is that, well, the governor said we can open up, so let's just open up. It's not that easy, and it's much more complicated. And when you're making decisions based on people's health and life and death, you better make sure you're right, or at least reasonably right, before you jump in. And that's why we're hesitating. We didn't find out about this change in guidance or change in regulation until late yesterday afternoon. We have a lot of calculating to do and figuring out how we keep people safe while accommodating people's desires to socially be around each other.
With that said, though, is there a possibility, any possibility at all, that parades or Christmas Village or any of those things could come back? Because it seemed pretty hard and fast that it was a no-go. So I'm wondering if this is a potential to bring it back.
I mean, doctor can give his opinion, but I don't see. I mean, the last time we had a pandemic in 1918, it got started with a parade, and I think 12,000 Philadelphians died. I mean, for the sake of a parade, I don't really think. For the sake of any event, I don't think people's life and safety should be toyed with.
Can I ask one more, or am I done? Am I cut off?
Well, I would love to, Annie, but we have about 10 other folks lined up. And in fact, I was going to mention that unfortunately, we only have about 15 minutes left and a good number of hands raised. So if you could limit your questions to 2 or fewer, I would appreciate that. Let's go to Jack Tomzik of the Metro.
Hello, this question's for Kelvin Jeremiah. Philadelphia Housing Action and Occupy PHA is saying that the encampment residents will be trained by, I guess, union members, and the union members will help them rehab 9 houses that PHA owns in Strawberry Mansion, and those properties will be put in a community land trust. Is that part of the deal? Because I didn't see those specifics in the press announcement.
Yes, that is in fact a component of the deal that we reached with the Occupy PHA folks. The union has graciously agreed to offer to provide labor and training to PHA residents and residents of the encampment.
Okay, thank you. And then this question's for Mayor Kenney or for Eva Gladstein. Where's the Where do the negotiations stand with the Parkway encampment?
Evie, you're most closely associated with that.
Yes, I was just unmuting, sorry. We're continuing to have discussion on a regular basis with the representatives of the Parkway camp and continue to make progress with them.
All right. Thank you.
All right, thank you, Jack. Let's go to Brian Mendoza of Telemundo. Brian,
Hello.
are you there?
Yes, I'm here. Armando, la primera pregunta para nosotros es, ¿cuál fue el acuerdo con el campamento de la avenida Ridge y qué pasará ahora? Se estaba hablando que les van a dar viviendas y van a entrenar a personas para que tengan trabajo. Si nos pueden explicar toda esa parte, por favor.
The first question has to deal with the agreement that was reached with the encampment on Ridge Avenue. It was announced that they would be given housing and they would get training in order to get jobs. What's the status on that?
As I mentioned, we did reach an agreement with the encampment on Ridge Avenue. We have already began the important work of having cleared the site. The encampment in Ridge, along with the residents, as of 8 p.m. last night, decamped and vacated the site. And so PHA is now in control of that location. And so our construction project can begin next week as planned.
Nosotros ya hemos llegado al trabajo importante de haber sacado a la gente y sus propiedades o sus artículos del campo. A las 8 de la noche de anoche han salido y han salido del lugar. La administración de vivienda de la ciudad está en control de ese lugar. Nuestro proyecto de construcción puede continuar según lo teníamos planificado.
Ok, y las negociaciones con el campamento del Parkway, ¿se cree que van a llegar a un acuerdo pronto también? ¿O cuál es el estatus de eso?
What is the status on the negotiations with the people that are encamped at the Parkway? Is there an agreement coming up soon? What's the status of those negotiations?
We're continuing to make progress in the negotiations with the camp at the Parkway, but there's no agreement at this point. No finalized agreement at this point.
Seguimos teniendo avances en nuestras negociaciones con los habitantes de ese campo, pero al momento no tenemos todavía ningún acuerdo, aunque seguimos haciendo avances.
Y la última pregunta, completamente fuera de lo que estamos hablando. El número de homicidios en Filadelfia ha sobrepasado a los del año pasado y aún nos faltan 3 meses para que se acabe el año. ¿Qué piensa el alcalde al respecto y qué pasos está tomando la ciudad para combatir esta violencia?
This question is for the mayor. Mayor, the number of homicides so far this year has overtaken the amount registered for the same during the last year, and there's still 3 months left. What are the steps and what is your message? What is the city planning to do to address?
As I said once earlier, this press conference, maybe you didn't hear us. We are doing our best to get people engaged with some of our young people in our communities who are at the risk of being shot or shooting someone. We're attempting to intercede in their lives to make sure that they have the opportunity, if they choose to, for job training and for job placement and mental health or substance abuse treatment. Our police officers are out there on the street every day putting their lives on the line to take guns off the street. We're taking hundreds of guns off the street a month. But because of the United States being the way it is in Pennsylvania, being a pro-gun state, those guns are replaced quickly. And where it's like whack-a-mole that we're dealing with these gun confiscations. I think COVID certainly and the financial depression that we're in have all exacerbated these problems. And as our economy hopefully gets better and COVID goes down, we'll have more opportunity to interface with these young folks and get them to put down the guns and get training and go to work.
Es un problema complejo y esto es algo que nosotros ya lo respondimos con una pregunta previa que tal vez no llegaste a escuchar. Estamos haciendo lo mejor que podemos para tratar de mantener a la gente comprometida y envuelta, especialmente la gente joven que sufre las posibilidades o está expuesta a crecer aquellos quienes disparan o aquellos quienes reciben estos balazos. Nosotros estamos tratando de otorgar oportunidades de capacitación y de ubicación de empleos para que puedan salir de esta situación. Obviamente es un problema complejo y se empeora por el hecho de que hay mucha disponibilidad libre de armas en las calles y nuestros oficiales están trabajando muy duramente para tratar de controlar este aspecto, pero tanto los Estados Unidos como Pensilvania son estados y están a favor de las armas, y estas armas, tan pronto se las saca de la calle, son reemplazadas inmediatamente. Y nosotros estamos procediendo con confiscaciones de estas armas. Por supuesto, esta situación se ha exacerbado por la difícil situación económica que se ha visto empeorada por la pandemia, pero confiamos en que el momento que la economía mejore y las cifras del COVID disminuyan, nosotros podamos involucrar a la gente joven para tratar de ser parte de la solución de este problema. Gracias.
Gracias, Armando. No es que no haya escuchado la respuesta, pero necesitamos algo en español. Muchas gracias.
Okay, thank you, Brian. As I indicated, we're very low on time with a lot of questions. So if the remaining questioners could limit to 2 or fewer, we would appreciate that. We will now go to Martin Pratt of Philly YBN.
Yes, this question is for Mr. Alexander or the mayor. The work that's being done in the city to prevent gun violence is laudable. With that said, I think a lot of people in the community don't fully know all the things that are happening. I'm not saying you need to tell any secrets or anything like that, but is there a plan in the early near future to be able to really inform the community about the different partnerships and different efforts that are really being done to in the south of Philly and in West Philly and in places like Nicetown, where you have these pockets of violence that have just exploded, specifically in those local communities, about the efforts that are being done, whether it's the police on social media, whether it's community activists and the church coming together. But it just feels like the community is just at a loss for what the administration is really doing on the ground.
Vanessa, maybe I think you more well versed in this, or Tumar. I do think that the inability for us to interact with people in a normal way has created kind of that situation. I mean, we're isolated from each other. We have to keep our distance. We have to wear a mask. We can't go to public meetings for the most part. Church groups can't meet over a certain number. I mean, those kinds of things have hampered our ability to communicate. But there have been activities that have gone on, and I just Tumar or Vanessa could
I'll let Vanessa chime in, but I do agree with you, Martin. We do have to do a better job pushing out our message just to everyday folks, everyday people. I think certainly we have a group of citizens who are very, very involved in gun violence advocacy, who we communicate with a lot and know a lot about what we're doing. But we were just talking, actually, I guess it was earlier this week or last week, about how we have to push out the message to the general public, right? Because the general public needs to know what the Office of Violence Prevention is, what the roadmap to safer communities are, what police are doing. So we absolutely agree with you. And I think you'll see from us a better job of us doing that, whether it's utilizing our all of our social media accounts. Certainly we have a blog, a violence prevention blog that we're going to put out. But like the mayor said, we've been a little hamstrung as it relates to COVID and COVID prevention, around gathering and going to community meetings. But we certainly will do a better job with pushing that messages out.
Hello, Martin. How are you? I just wanted to add that you are right. We do have a coalition of community folks that we work with, predominantly community advocates. We obviously, before the pandemic, it was easier to get around the community groups. We are definitely trying to expand that so that the message can be heard. We also have a meeting coming up this week with the faith-based community so that they can help us to some degree with getting the message out. There is a blog that was just posted that's on the Office of Violence Prevention website that talks about 10 things that we're doing to combat the gun violence. But I do want to highlight just a few things because some folks in the community may have seen. We call a Community Crisis Intervention Program, or CCIP. They are outreach workers that I actually call the boots on the ground. We have over 50 of them out across the city in different neighborhoods, but predominantly in the neighborhoods that are most impacted by the gun violence, where they actually act as liaisons with folks in the community to talk to them about how to get services or how to connect with the government and or police. But more importantly, they actually talk to some of those folks who are actually caught up in the gun violence to try to explain to them that there is another way that their life can go, offer them services. We try to de-escalate situations before they escalate up to gun violence. So they are out there in those neighborhoods. But we've also launched what we call a group violence intervention program, or GVI, where we're actually trying to get to that small number of the population who are actually driving the violence in most of these neighborhoods. We launched it the first weekend in August, predominantly in the West Philly, Southwest Philly area. We were in the 18th, the 12th, the 19th, and the 16th police district. We're encouraged about progress we are beginning to see there. We think the message is getting out. And basically, GVI is a collaboration of law enforcement, social services, and community coming together saying enough is enough. The shooting must stop. But we offer you a myriad of social services if you're willing to avail yourself of them so that we can help you change your life or get out of what you're doing in that life. We are about to start working in the Central Division, moving over to the 22nd District, 22nd, the 9th, and the 6th. And so we will definitely be putting out more information pertaining to that and what all is entailed in the group violence intervention. But those are just two things I wanted to highlight quickly.
And Vanessa, you guys are going to definitely inform us as press about these because I knew nothing about that.
Absolutely. In fact, we can pull together. We'll be doing some community meetings that we will invite you to as press, where we can put a more robust presentation on group violence intervention out there. There's been a few press pieces about it out, but again, it is new. Just started, like I said, first weekend in August. We're out every weekend predominantly in these neighborhoods, and it consists of, we're doing custom notifications because we did have to change the way the model would traditionally be done because of the pandemic. So we actually are going to folks' homes and trying to meet people where we can get to them to deliver that message.
Thank you.
All right, thank you. Let's go now to our Henny's Figueroa of Univision. And our Henny's, again, we're very, very close to being out of time. So if you could limit it to 2 questions. Henny's, you're up.
¿Me escuchan? Yeah, I'm here. You hear me?
Yes, go ahead.
Cool. Armando, por favor, me gustaría saber, ya sea del alcalde o del Departamento de Vivienda, qué es lo que impide a que se llegue a un acuerdo en el tema de los campamentos.
This is a question that's either for the mayor or for the housing department of the city. What is the obstacle in reaching an agreement with the population in the camps right now?
Well, it's like any negotiation. People want certain things are possible, certain things are not possible. I think there was somewhat of a misunderstanding about what the city itself could do in some of these areas and what needed approval by the state or by the federal government. So we kind of ironed all that out, and we're moving towards a peaceful conclusion. The alternative is to forcefully, with police, remove people, and that's not a pretty sight often or any time, and we try to avoid that, and we think we're almost there.
Como con toda negociación, hay ciertas cosas que son posibles y ciertas cosas que no son posibles, pero creo que ha habido un malentendido con respecto a qué es lo que la ciudad podía hacer en algunas áreas porque se requería la aprobación del Estado, del gobierno federal, pero creo que hemos estado resolviendo todo esto y estamos llegando a una conclusión científica. La alternativa sería ingresar con la policía por la fuerza y eso no es algo que quisiéramos ver ahora o en ningún otro momento. Y estamos tratando de evitarlo. Por lo tanto, estamos casi ya acabando esta negociación y esperemos poder llegar a buen puerto. Gracias.
Okay, es decir, que el alcalde espera que esta negociación finalice antes de que llegue el clima severo.
So, Mayor, your expectation is that these negotiations would be concluded by the time severe weather is with us?
I would hope we conclude it tomorrow or yesterday. So as soon as we get it done, it'll be done, and we hope it's sooner than later.
Me hubiera encantado que se concluyeran estas negociaciones el día de ayer o el día de hoy. La vamos a terminar cuando esté terminado todo y esperemos que sea más antes que tarde.
Muchas gracias, Armando. Gracias, alcalde.
Gracias.
Thank you, gentlemen. And let's go now to Mike Donofrio of the Tribune.
All right. Just 2 quick questions regarding the settlement with the North Philadelphia protesters. Is the administration considering a similar agreement with protesters on the Parkway? And I'm talking about transferring PHA-owned homes for this work program.
Eva?
The conversation that we've had up till now has included representatives of both of the camps and has had similar items under discussion.
I mean, is the administration considering a similar agreement?
I'm not sure what you mean, Mike. We've made a number of offers and we've been discussing some potential transition of properties, which was reported over the last few weeks, and those discussions are ongoing now.
All right, and then maybe for Kelvin, can you just provide a few more details about what this PHA's pledge here is to provide 25 permanent housing opportunities for homeless families related to COVID-19? I'm just trying to figure out, is this different than the work program? When will they become available, these opportunities?
Unmute.
Oh, sorry. Yes. Sorry about that. So the 19. Hello.
Yeah, go ahead.
The 25 COVID-19 related preference stems out of HUD regulations that, and along with the CDC, that encourage housing authorities to look critically at how we can provide additional assistance to families and individuals who are impacted by COVID-19, whether they're at risk of becoming homeless or are in homeless shelters, so as to reduce the risk of contracting the disease. Those 25 housing opportunities are unrelated to the encampment, though folks from the encampment may very well be eligible for participation. It has not yet passed the PHA's Board of Commissioners. That is slated to be considered by the board next week. And so folks who might be at risk of losing their existing home and facing homelessness, folks who are currently homeless, folks who might want to be transitioning from homeless shelters would be eligible under this new preference.
And then just how soon could they become available?
It expires at the end of the year first, and so it requires first and foremost the board approval, what we hopeful that we'll get next week. Once that happens, it will be implemented immediately.
And just to be sure, I wasn't clear on that one point.
Mike, we're really out of time here. If you want to just make it a quick question. Go ahead.
I wasn't sure. So the housing, the people can only get housing until the end of the year through this program?
No. The opportunity will exist until the end of the year.
All right, got it.
The housing that we will provide is permanent housing.
Okay, thank you.
And thank you, Mike. We are out of time, but we're going to go quickly to two reporters who have not had a chance to ask anything. First, Jimena Conde of WHYY.
Hi there. Just one quick question. Has the mayor given any thought to declaring a citywide emergency regarding gun violence as suggested by some members of council?
If you can define what happens when you declare a state of emergency, there are varied types of emergencies, including curfews for people who are law-abiding citizens who, would have to be in a certain time of night. That's a difficult. It sounds effective, and it sounds good, or it sounds like it could be effective, but there are actual issues that we'd have to work out to see just what a state of emergency means. We did declare a health emergency as a result of the increase in gun violence, but a quote unquote state of emergency brings with it lots of things that will hamper people's ability to move around and be out at certain times. And I don't know if we're at that point.
Mena, are you done? Good?
Yes.
Okay, great. And finally today, David Melandra of Philly Sports Network.
My question is for the mayor and for Dr. Farley. As we know today, the governor increased the gatherings limit. When will you have your decision made about, say, if Temple University and the Philadelphia Eagles will be able to have fans for the games next weekend?
We learned about this change in the governor's position late yesterday afternoon. We haven't had a chance to really look at things that affect the largest city in the Commonwealth of Pennsylvania, which is not comparable to a small town in the middle of the state or in the western part of the state. It's not even comparable to Pittsburgh. In addition to sports, which seems to be what everybody's interested in, there's other implications and other issues when it comes to theater and other types of indoor events. So it's multifaceted. We want to make sure that we're not putting people in danger. I want to go to a football game too. There's nothing I miss more than Eagles football on Sunday. but I don't think it's worth putting people's health in jeopardy or people's lives in jeopardy. So we want to make sure when we get these regulations that we do it right and that we've taken everything into account, not just jump blindly into an emotional issue.
David, are you good? David?
Yeah, I'm good.
All right, very good. Then we are all set. We apologize to those who we were unable to get to a second time, but you could send those questions to press@phila.gov. Our next COVID briefing will be on Tuesday, October 13th at 1 p.m. Thank you.